think it's really important for employers to pay attention to where the evidence is. There are a lot of solutions out there that have limited evidence in terms of their effectiveness at promoting mental health wellness and reducing mental health problems. And I think scrutiny around which investments that employers make in different contracts and partnerships is going to be really important, because we want to make sure that we're holding the entire organization to high standards in terms of the evidence behind the resources that we offer employees.
Hey friends, welcome to the Changing Work podcast. We are so glad you're here.
My name is Nick.
And I'm Scott.
And this is the podcast where we talk about changing work from the inside out.
So if you're into making the workplace and the world a better experience via conscious business practices, stick around. This is for you.
It's good to connect with you. I'm going to read a really quick bio of you, and then if I missed anything or if you'd like to add anything, I'd like to kick it over to you, and then we'll get rolling. So Jessica is the founding director of the Lab for Scalable Mental Health and associate professor of the Medical, Social Sciences, Pediatrics, and Psychology at Northwestern University. She also serves as director of digital services at Northwestern Center for Behavioral Intervention Technologies. Dr. Schleider's professional mission is to build, test, and disseminate scalable, evidence-based mental health solutions that bridge previously unfillable gaps in the mental health ecosystems with a focus on single session interventions, or SSIs, for underserved youth. She has created or co-created 7 access single session mental health programs, which has reached 50,000 people to date. Based on these programs, she and her colleagues wrote a self-help workbook, the Growth Mindset Workbook for Teens. She also co-edited the Oxford Guide to Brief and Low-Intensity Interventions for Children and Young People, and wrote a nonfiction book, Little Treatments, Big Effects, on how single-session interventions can transform mental health. I've been doing a little bit of research on Jessica over the last few days, and I'm particularly excited to have this conversation with you. Welcome, Jessica.
Thank you so much for having me. Delighted to be here.
Thank you. So I'm curious, after I gave this bio, I always feel this way whenever somebody reads my bio. I'm like, yeah, that sounds like me, but maybe there's a couple things that are missing or that I might like to add in there that might be more up to date. Is there anything else there that we missed you'd like to highlight with our audience?
I mean, that really does cover it. I've spent the last 10 years or so studying how to make individual clinical encounters or moments count for mental health improvement, largely because the system we have for mental health support just isn't meeting folks' needs on a broad scale. So the mission is to use science to figure out how to help people when they first seek out support, knowing that for many individuals, that first time may be the last opportunity they'll have to access anything helpful.
Yeah, no, it's such an amazing thing that you're doing here. And I'm kind of curious, so you're particularly focused on like underserved youth, and it sounds like on teens, but I imagine a lot of these SSIs are really applicable across different industries and across different domains. Before we kind of get into that, though, I'm kind of curious a little bit about like what brought you to this work. I mean, obviously there's a gap that's being filled here, but what kind of inspired you to focus on these particular modalities?
Absolutely. So the reality of mental health care in the US is really unfortunate when you unpack it. The situation we're up against right now is that 50% of adults and around 80% of young people with mental health needs get no treatment whatsoever. So all of the research that we've been doing and work that we've been doing to disseminate evidence-based therapies is great for the few people who can access those therapies, but not so helpful for the many people who fall through the cracks of our system. We're never going to have enough trained mental health professionals to meet everybody's needs. So when I was in graduate school and undergraduate, I really got just fixated and frustrated on this huge gap that mental health research and treatment wasn't filling. So I pivoted towards scalable mental health. I direct the Lab for Scalable Mental Health. And what that really means is how can we create solutions that can address the many, many people who wouldn't otherwise get anything, whose needs aren't being met. And as I began studying single session therapies, I also really reflected on my own experience as a teenager and as a young adult, getting lost in mental health care systems myself and not being able to find treatment when I needed it as a teenager and later as a college student and grad student. And I talk about this a bit in my book, but I've had my own experiences of individual moments being sort of a turning point or an inflection point in my own recovery. And that's a perspective and reflection that I bring into the science that I'm leading now, on how to make individual turning points for people more possible and common.
So interesting. Yeah, and so I'm really curious about like these modalities, these SSIs. So what does that even mean? Like what are we talking about when we're talking about like a single serving intervention like that, or a single
Sure.
session
So
intervention?
single session intervention, or SSI, because the former has too many syllables, is any program that intentionally, and that's really important, involves just one encounter with a support person, a provider, or a program. And I say intentionally is really important because often folks by accident have one session mental health treatments. Like they'll go to a primary care provider and get brief feedback and a referral list, and then they'll be sent on their way. But there was no intentionality in that kind of encounter to make the most of that one interaction, and to treat it as a standalone support. So a single session intervention is any encounter that's intentionally designed to make the most mental health wise, coping wise, support wise out of that moment, not assuming that there will be others.
Mm.
It's very different from how traditional psychotherapy is thought about, which is, oh, this is a journey that happens over months and months or even years in some cases. A single session mindset, when you bring that to bear as a therapist, is treating every session as though it could be the last and making it count.
Mm.
Um, and SSIs can be potentially the only thing somebody gets, or they can be peppered into longer term courses of support. But the real emphasis is that there's no assumption that there's going to be future opportunities. So we're just making the most of the moment.
And so what do these actually look like, in terms of interventions? Are we talking about like talk therapy? Is it a video? Is it resources that they read? Like, give us some like more details on what this actually
Great
looks like.
question. Yeah, so single session intervention is an approach to offering a support, not a specific modality or delivery style. So they can be lots of things. They can be a self-guided digital tool. That's a lot of the, programs that our lab tests because of the inherent scalability of something that can be self-guided. They can be delivered by a trained professional, or they can be delivered by a peer-to-peer supporter who's trained in the modality in particular. But no matter what the modality, or whether it's self-guided or human facilitated, a single session intervention teaches essentially a bite-sized component of a longer term course of evidence-based treatment, like one element or one idea from cognitive behavioral therapy, for example, or one idea from mindfulness-based therapy, that is shown scientifically to be able to stand on its own, and that helps people feel more hopeful and able to take the best next step for themselves towards a future that matters to them. And the key in an SSI is that we're not trying to solve all your problems in one session. That's not realistic or fair to expect of yourself, but we can always take that best next step. And by the end of an SSI, somebody typically has a plan, a guided action plan that's personalized to their needs for taking that step for themselves towards whatever future they have in mind as being important.
And in terms of outcomes for individuals that are taking advantage of SSIs like this, it sounds like agency is a big component of it, and as you mentioned, hope. I know from my own journey in mental health and trying to find the right therapist and the right modalities really work for me, it can be very hopeless, going through these processes and just like the rigmarole that has to be involved in trying to find an available therapist. Like, I'm kind of curious, like with these SSIs, is that something that kind of changes the impression of the individual of the overall process, and what are some of the outcomes you might expect from that?
Yeah, so I can talk a lot about the outcomes that we've studied in our research. So we've done clinical trials of tens of thousands of people at this point, looking at both self-guided single session approaches on their own sort of as standalone supports, and as human delivered approaches, which are often in our work delivered to people who are on really long waiting lists for treatment, which is a huge problem because people get worse while they wait. The outcomes that we look at in the immediate term, right after somebody has taken this intervention or tried it out, are pre to post changes in a sense of hope for the future, the degree to which you feel like change is possible for yourself, and the degree of perceived problem solving ability. How confident do you feel that you can solve problems that come up for you? And we've actually seen in our studies that immediate shifts in those two factors predict the likelihood of future shifts even months later in our work 3 to 9 months later in depression symptoms, anxiety symptoms, overall hopelessness months later, and even in some of our research, disordered eating symptoms, depending on the population. So they can have initial effects that spur what we like to call upward spirals of change, where that first step that you can see yourself taking during the intervention helps you understand, oh, I can do something. Whereas before there was no necessarily conception or a picture of what that would look like. In traditional therapy, usually that first session is simply describing your history, right? Describing what's happened to you so far, what you've been through, where you're going maybe. But it's much less directed and much less focused on getting you one step forward from where you are right now in this moment. So as a result, a lot of people do leave those first sessions in longer term therapy being like, that they just asked me about my life. I want to solve problems. So it's a missed opportunity, I think, in that first session often to take a single session mindset and help somebody get one step forward in a meaningful way.
Yeah, I imagine, especially if you're interviewing multiple different therapists, you're basically just regurgitating your life history over and over and over again and not really making a ton of progress. And I know just, again, from my own personal experience, how frustrating that can be. And so many people might just stop at that stage and not continue to get help. I'm kind of curious, you mentioned the lack of available therapists as one potential issue that's happening within the space right now. But, in your opinion, what would you say like some of the biggest challenges are of like scaling evidence-based mental health solutions? And how are you addressing those in your work exactly?
There are so many challenges, which is part of the fun. I think one of them, of course, is this shortage of mental health providers, but we solve for that, and many groups and research teams and organizations have been solving for that by task sharing. So training lay health providers, people without licenses to practice psychology, in smaller scale interventions that can be delivered with fidelity or faithfully, regardless of prior training. And one of the single session interventions my team has developed and tested, which is called the single session consultation. So not therapy, just a one-time solution-focused consultation. We actually designed that so that it could be delivered by anyone, not just people with a PhD in clinical psychology. And so that's one way of expanding the possible workforce. But that also links to another big challenge, which is payment models. And getting large payers, Medicaid and others on board to reimburse for these kinds of alternative services. We're looking at doing that, and we've made some progress getting, state level waivers for trying out single session approaches for folks on waiting lists in Medicaid funded clinics, for example. But we're at the very tip of the iceberg in making that progress. And that, I think, is going to be necessary to sustainability. The other way that we've tried to scale up, of course, is by removing therapists or humans from the equation. There's good research out there that digital mental health supports, including those that don't involve a human, can be helpful to folks. They're not going to solve everything, but you need so many different puzzle pieces to make sure that there aren't really gaps in the system and that we're meeting people where they are, because some folks will want to talk to a human, some folks may not feel comfortable yet, and a digital self-help tool is going to be crucial for those people.
And imagine too, just kind of bringing down people through a funnel of like deeper and deeper engagement with therapy and with like the type of support they need. It sounds like some of these SSIs would be like a really good top end of the funnel for folks, where if they're not necessarily ready, or maybe they're not completely open to therapy yet, having these other modalities might be a way to crack the door open a little bit for them.
100%. And that's another one of the outcomes we've assessed in our research is openness to treatments, beliefs that treatment could help, and a readiness for change. Those things all tend to improve after a single session intervention per various clinical trials that we've run. So this is also absolutely a way to open that door for folks who may be hesitant or who may not be sure that this is for them. It can also be opening a door to seeking non-therapy types of support, right? Regardless of the type of support folks receive or seek out after a single session intervention, the reality is still the same, that an increased hope that change is possible is a crucial starting point for seeking any kind of support.
Yeah. Yeah. You mentioned this idea of waiting lists. And I imagine in a perfect world, anybody who is on a waiting list would basically be getting one of these SSIs while they're waiting for whatever comes next. Where else do people come across these types of interventions?
Well, currently, they don't come across them in too many places, which is one of the reasons I wrote the book, was to make this model more commonplace and ubiquitous in our healthcare ecosystem, because I really do think it's well positioned to fill some of those gaps. But other places that we've studied single session interventions are within primary care clinics. Often folks, have de facto single session interventions with their primary care providers because they're not going to go in every week to primary care. And in many clinics across the country, screeners for things like depression or anxiety are commonplace. But when people screen positive at their primary care appointment, they are often just given a list of referrals to people who have wait lists of 6 months. So we can offer SSIs to folks right in those moments of identifying people with high symptoms to try to solve for that. And other applications are within social media platforms. There's a lot of buzz and media coverage right now about the potential harms of social media for mental health. But given that social media platforms probably aren't going anywhere anytime soon, there is a huge potential there to embed evidence-based single session supports and other kinds of low intensity supports into social media platforms. Our lab has had a partnership with a nonprofit digital mental health organization called COCO. And COCO contracts with social media companies to embed mental health supports directly into those apps.
Hmm.
So when people search for things like depression or therapy or suicide, they're offered supports right away.
That's incredible.
To embed our single session interventions into their suite of offerings to people. And we've published our work showing that, in a year, more than 6,000 young people tried our single session interventions within COCO, just naturally deploying it. And we saw improvements in hopelessness and reductions in desire to self-harm that were matching those that we saw in our more controlled trials. So it is possible to use social media for good, at least in some ways, or connect people with supports precisely at moments of need when they're searching for those terms, using this kind of approach.
It makes complete sense. I mean, back to what your statement was earlier in terms of like meeting people where they are, if young folks in particular, as kind of the focus of a lot of your work, are going to be on social media, having interventions and having other options for them through those mechanisms seems like an obvious choice. I'm kind of curious, in terms of, so that's one type of technology, that we're leveraging to access these types of interventions and get them in the hands of the people that need them. Where else do you see technology kind of playing a role in the future of mental health interventions?
So many ways. And I think there are lots of considerations to how technology is interfacing with mental health treatment. I think technology is the future of mental health treatment and the present in a lot of ways. And I think that's really exciting because of the accessibility doors that it opens, and also really important to stay critical of. Just today in Mashable, there was a series of pieces that came out by Rebecca Ruiz detailing safety problems in digital peer-to-peer support platforms that were deployed all across California. And the potential for harm is, of course, magnified with the potential for scale. And those are really difficult things to align. I think there's tremendous potential, and we can't just abandon these solutions. But I think by intentionally partnering across academia and policymakers and tech companies, I think that cross-sector collaboration is going to be critical for making sure that the tools that do get out there on apps, on social media websites, into our everyday lives are those that are backed by evidence and safe for users to engage in. I think the fragmentation across folks in industry, folks in academia, and the sort of lack of communication has caused a lot of problems.
Yeah, yeah, and so there's so much that you just listed there in terms of like some of the challenges and complications. I'm kind of curious in your opinion, like, I don't know, maybe say over the next decade or so, like, how do you see like the mental health space changing? I mean, obviously technology is a big piece of this. AI might be coming more into the forefront of this. I imagine research, like the research that you're doing, is going to be becoming more and more important as we think of new modalities and new ways to reach people where they're at. Like, how do you see that evolving over the next decade?
Well, I think it's already starting to evolve, but the technology is always further ahead than the policy. So it's a huge challenge. I think one of the pieces is going to be regulation. Regulation of what constitutes a mental health treatment, what constitutes therapy when it's delivered digitally, and what body is going to be regulating the safety of those tools. Right now, it's kind of the Wild West out there with a lot of things not regulated at all, which leaves a lot of openings for harm and challenges. Um, I think with AI, people are already on their own using the AI tools that exist, ChatGPT, GPT-4, as kind of therapists. And I think they're just chatting, right, with GPT-4, and that's a pretty common experience. And that is, I think reflective of the massive shortages in options that people have to seek out support. It also creates an opportunity for organizations to responsibly think about what kind of guardrails do we need to put on AI in order to make it actually an effective resource for people. And it opens up a lot more doors for possible harm. What if ChatGPT doesn't respond in a therapeutic way and instead, accidentally, because it's not a human, responds in a harmful way? So there are so many unanswered questions, but as I said before, I think the future of this work is cross-sector collaboration and partnership. I think there are so many different incentives and goals that exist in this space across different sectors. And it's going to be really important for checks and balances to be incorporated to make sure that we're actually serving the end users, people who need help, in a way that meets their needs.
Mm. So I know you focus largely on youth and teens. We're Hacking HR Summit, People Summit. We're talking a little bit more about the workplace in a lot of regards here. Where's the crossover from the work and the research that you're doing now into maybe supporting adults or people within the workplace with these type of modalities?
Yeah, so I think there's a ton of crossover because people's jobs are a huge source of stress for them. People's managers are the number one reason, that people get distressed at work and may struggle with mental health difficulties or just exceeding stress levels that require more support. So I think embedding these kinds of tools into the suite of options available both to employees through EAPs or other kinds of systems, but also to managers support them in developing communication skills and team management skills and the stresses of leading a large team. I think both of those are huge unmet needs in the workplace. And I tend to think that a single session intervention approach is much more likely to be accessed and acceptable to folks who are already overwhelmed with obligations and responsibilities. And embedding evidence-based single session approaches like the single session consultation, which is essentially a problem-solving activity that could help anyone regardless of their starting point, would create a lot more on-ramps for people to seek out support that feel less overwhelming, perhaps than longer-term therapy.
Yeah, you mentioned this idea of managers kind of having this outsized influence on our well-being and our mental health within the workplace. And it sounds like there's two opportunities here. There's one of like a mental health awareness opportunity to help managers and leaders have a better understanding of the language and just the experience of people that might be struggling with mental health. But then you also mentioned something which I think is really important too. So many managers are being squeezed from multiple different directions. Their work is incredibly stressful as well. How do you see the role of like these types of modalities or interventions in terms of like helping to educate people and help them better understand the experience of others versus understanding their own experience? I don't know if much of your research kind of covered things like that too.
Absolutely. So I can use the single session consultation as an example. Within this intervention, people are asked to identify a problem that is important to them right now, regardless of what that problem is. So that problem could be, I don't know how to communicate with my team. I don't know how to manage the stress that I feel around not knowing, where my team members are at or what's going on at different levels, or I need more help than I have. And the goal of that intervention is to help people make a really concrete action plan to help them take the next step towards addressing that problem in some way that feels tangible. So those interventions are an opportunity for people to, address different kinds of problems, regardless of the location of those problems within themselves or external. And I think by breaking it down in this more approachable way, it's possible to then embed some education around, normalizing people's experiences. Or familiarizing people with how common it is what they're going through, and orienting them to resources that already exist in their organization. So I think there could be a nice dovetailing between resource provision and this kind of solution-focused single session action planning that could open potentially new ways of getting support that's more efficient and more impactful for folks who need it.
Yeah, that's an exciting future. I'm curious too, and maybe this is a little bit outside of your research, but what role do you see the employer or companies playing in terms of helping people with their mental health at work, or even beyond for that matter?
Yeah, so I think employers play a huge role because they're the ones who are signing on to plans or resources, or signing contracts with companies that provide workplace-wide resources to the people who work at their organization. So trying to figure out, there are a lot of options, of course, and that's a difficult landscape to navigate. But trying to figure out what are the resources that folks from within your organization are saying that they want, what kinds of support are they saying that they want, what formats of support, and listening to folks' needs. I think that's a really important starting point, because that can inform the kinds of solutions they invest in, or kind of look for when they're figuring out what kinds of tools to provide to everybody. But at the same time, I think it's really important for employers to pay attention to where the evidence is. There are a lot of solutions out there that have limited evidence in terms of their effectiveness at promoting mental health wellness and reducing mental health problems. And I think scrutiny around which investments that employers make in different contracts and partnerships is going to be really important, because we want to make sure that we're holding the entire organization to high standards in terms of the evidence behind the resources that we offer employees.
Yeah, and you mentioned EAP earlier too, and I don't know what the actual data is on it right now, but my understanding a few years back, as the pandemic was kind of picking up, mental health was being strained quite a bit for employees. There's a lot more conversation around mental health and well-being in the workplace, and yet EAP services were still relatively low attendance, or low. People were not taking advantage of this fully as maybe they were available. I'm kind of curious, like, first of all, like what you think is maybe driving that behavior where people aren't taking advantage of EAPs, and maybe where some of these interventions that you're talking about might kind of play a new role to help open the door up a little bit.
Absolutely. Well, a lot of and this is why I mentioned the importance of listening to employee needs. A lot of the services offered through EAPs are not necessarily anonymous and are high commitment. So they require always talking to a human, or they require repeated visits of some kind, or repeated usage of a service or support. And one of the ways that single session interventions can help fill those gaps is that there's such a low barrier to entry for people seeking help. There's no expectation or commitment beyond that initial session. And there are options for not talking to a person and completing a self-guided tool totally anonymously, rather than having to be connected. It can be really daunting for employees not to be sure where their information is going to go. Even if they're told it's confidential and private, seeking support through their employer can nonetheless feel somewhat daunting, because they don't want, stigma against mental health is very real. So I think creating on-ramps that require less of people, and identifying solutions that can help people at moments of need, whether or not they're comfortable engaging in something more intensive, is a big part of what would help those services be better used.
And Dr. Slider, you mentioned way earlier in the session, we were talking about this idea of agency and hope. And I'm kind of curious, I've been asking a lot of folks that I've been interviewing for this event, what brings you hope for the future?
What brings me hope is the enthusiasm that I see around innovation in the mental health space, both from within academia, but also from lots of different sectors and organizations. Everyone seems to be, especially since the pandemic, taking this problem much more seriously. It's not something that was created after COVID, but it's something that got a whole lot more attention because it was so widespread and extreme. So I'm hopeful that through this kind of cross-sector partnership and thinking creatively about how we can fill the clear gaps in our system, that we can capitalize on the momentum we're seeing now and really invest in solutions that have evidence behind them, have potential for scale, and that meet people where they're at.
Mm. I'm kind of, I'd love to help people find where to find you. So if people are interested in learning more about you, your research, or even some of the books and workbooks you've created, where's a good place to point people towards?
Well, I'm on LinkedIn, so that's an easy place to find me. Also, my lab website, schleiderlab.org, has a lot of different resources, including lots of open access, anonymously available single session interventions for anybody to try out themselves.
Mm,
So those two places I think are a good starting point.
beautiful. Well, Dr. Schleider, thank you so much for the work you're doing in the world. Thank you for being here and for sharing your wisdom with the rest of us. And we hope to see you again sometime soon.
My pleasure. Thanks for having me.